Good morning all, and a very warm welcome on behalf of MYT and Sightsavers. We're very much looking forward to supporting you today. We'd like to open today with a few housekeeping notes. In today's webinar, we will have closed captions available. To view, please click on the Closed Caption Zoom menu button at the bottom of your screen and select Show Subtitles. To increase the font size, select Subtitle Settings, move the slider to adjust the caption size. We also have a sign interpreter with us today available during today's webinar. For the best international sign experience, we recommend the webinar is viewed in speaker view, as we will be spotlighting the speakers and sign interpreters video throughout. If a presenter is screen sharing, you can resize the interpreter's video by dragging a vertical divider. During the webinar, please put any questions or comments in the Zoom Q&A button at the bottom of the Zoom app. We will be reviewing these and we will get through as many questions as we can. We encourage you to use social media channels to promote and engage a wide audience with this event. Please use the following hashtags: Data4SDGs and hashtag Leave No One Behind. This webinar will be recorded. We will share the recordings with you shortly after the webinar. We will be using Zoom polls throughout this webinar. The polls will appear on your screen and you can select the relevant option. All polls will be anonymous. There will be a short survey in the format of a Zoom poll at the end of the webinar. We ask you to complete this survey so we can improve future inclusive data learning events. The MYT team are here to help you with any technical difficulties. Please use the Zoom chat facility to ask any technical questions or email the team at admin@sightsaversevents.com, where the MYT team will help you. I'd like to now hand over to Dom.
Thanks very much, Georgina. First of all, welcome to everyone, and thank you for joining what's proved to be a very popular session. We're at, I think, 260 people plus and rising as we go. So I'm really delighted so many of you have tuned in to talk about inclusive data and to hear from our excellent panel. Apologies at the start, as this panel stage also happens to be my kitchen and a homeschooling environment, so there may be some background noise at points. I'll try my best to keep that to a minimum. Just a few words from me before we begin. I know that many of you will have been active in the gathering, the analysis and the use of data for many years. I think it's fair to say that data for development, and in particular data to improve equity of outcomes, has never been as hot a topic as it is right now. I remember back in 2015, as the negotiations around Agenda 2030 and the SDGs came to a close, and discussions around measuring progress, including equity in that progress, began in earnest. I've just got a poll popping up in my screen, sorry. Bear with me a moment. Began in earnest. I don't think the UN stats team had ever been so popular, and statisticians started to be referred to as the rock stars of development. In those early and heady days, access to people leading that process was incredibly open. And I think some were hugely confused to find people knocking on their doors and making appointments to meet with them, emerging from statistical isolation and into the spotlights on the main stage of the SDG debate. Fast forward to 2021, and those heady days seem a long time ago. Official processes have become complex, and there is not as much openness of dialogue as there once was. The agenda of Agenda 2030 and our ability to measure that vision has met the reality of a paucity of data and the difficulties inherent in the measurement of equity. Which is why this workshop is so important, because our panelists today are going to share some of the many lessons learned from where the rubber hits the road, bringing that vision and that optimism into reality. Initiatives such as the Global Partnership on Sustainable Development Data and the Inclusive Data Charter are gathering pace, and we're increasingly able to say that this can be done. There are lessons to be learned, but we can measure equity across a range of areas around the entire globe. So what have we learned? That's what our esteemed panelists are about to share with you all. We're going to hear from each in turn, with a break for questions between each presentation. We'll also hopefully have some time for questions around all the presentations at the end. So please do fire those questions away in the Q&A that you can find at the bottom of the screen. Or if you can't find that, you can pop them in the chat and we'll try and get to as many as possible. So that's enough from me. Without further ado, I'd like to pass to our first panelist, Alex Goldworthy of HelpAge International. Alex, the floor is yours.
Thanks, Dom. So yeah, I'll wait for the slides to get up for starting. Yeah, can we move to the next slide? Thank you. So yes, good afternoon. As previously mentioned, my name is Alex Goldworthy and I'm a Humanitarian Program Officer at HelpAge International. I want to thank Sightsavers for allowing me to present today and thank you all for attending. The focus of my presentation is to highlight how we at HelpAge have collected inclusive disaggregated data and explore some of the challenges we face and lessons we are learning. Just to clarify, disaggregated data means breaking it down information into smaller subpopulations, for instance, breaking down data between men and women, which I'm sure most of you will be familiar with. I'll be using our rapid needs assessment as my primary case study. They are carried out for three main purposes. Firstly, to provide HelpAge and our partners with a snapshot of needs of older people. Secondly, to develop our programs. And thirdly, to support our advocacy work around older people in emergencies. As many as you will appreciate, older people are often left behind both figuratively and literally during humanitarian crises. When we undertake our rapid needs assessment and other data gathering exercises, HelpAge is committed where possible to collect inclusive data, which means for us, data disaggregation by disability and by location. We're yet to include disaggregation by income status, but again, we are exploring ways in which this can be done. Key advocacy messages is to encourage other agencies to collect and disaggregate data by 10-year age cohorts. This is because the impact of the crisis may be very different for those in their 60s compared to those over 80. We can only look at the COVID pandemic to see the importance of banding in this way. And we conducted a rapid needs assessment in 11 countries, including Ethiopia, Mozambique, and Yemen, seeking to understand the multi-sectoral needs of older people. Through these needs assessments, we explored areas such as food insecurity, as well as health and shelter needs. Our total sample size range from 120 and depending on the context and specific purposes. Next slide, please. Next slide, please. Thank you. Subsequently, with the advent of COVID-19 and this disproportionate, can we go, sorry, back a slide, please? Can we go back a slide? Thank you. Subsequently, with the advent of COVID-19 and its disproportionate impact on older people, we conducted 19 rapid needs assessments. Again, can we go to the next slide, please? Perfect, this is the one. Okay. So yes, COVID-19 is a proportionate impact on older people. We conducted 19 rapid needs assessments between May and August of last year and interviewed more than 4,000 older people to better understand how older people's needs were impacted by the pandemic. These assessments were frequently conducted by partner staff with the support of HelpAge. Through this collaborative approach, we build with these partners as well as spread the message of the need to improve more inclusive data collection approaches. Next slide. Thank you. In order to collect and report on older people with disability, we included the following key questions. Regarding our regular rapid needs assessments, e.g. our pre-COVID, which is on the left, we use the Washington Group short set of questions to identify those who have a disability. Using the Washington Group methodology to categorize those as having a disability on a binary scale. For example, for our first question, do you have difficulty seeing even if wearing glasses? If the respondent answered a lot of difficulty or cannot do at all, we categorize them as having a disability. This question has a total of 70 questions, 17 of which are focused on disability, examining areas such as access to assistance and the use of assistive devices. The questionnaire typically took 45 minutes to complete. During our COVID-19, unless safe to do so, we conducted our rapid needs assessment interviews over the phone. Due to this data collection method, we reduced the length of the questionnaire and reformulated those key disability-focused questions in an attempt to quicken the time it takes to answer them. You can see this on the right. In terms of reporting, I analysed all the data using Excel, provided disaggregated data tables to in-country staff and sectoral experts to analyse and use in formulating programmatic interventions. This took around a month to produce a COVID-19 rapid needs assessment report after data reached me, which is again an area we're kind of seeking to improve on the speed. Next slide, please. I'll now share some of the areas for consideration based on my personal experience of collecting data during our rapid needs assessments and COVID-19 rapid needs assessments. Firstly, even in emergency, trying questions is important. For example, regarding disability, the Washington Group questions provide a tried and tested disaggregation is universally applied in a similar way. However, when we were designing our COVID-19 rapid needs assessments, the questionnaire, we felt that the Washington Group short set questions was not short enough. This was because we were cognizant of the need for phone interviews to be as brief as possible. This led us to a compromise. By using a grouped version as shown in the previous slide, e.g., do you have a lot of difficulty or cannot do at all for any of the following? However, this subtle reformulation could be construed as slightly leading, which resulted in an overrepresentation of those with disability in our analysis. Especially as the options were yes or no, compared to reading out the no difficulty, some difficulty, a lot of difficulty, or cannot do at all. We are working under time pressure. With hindsight, we should have perhaps tested these questions more thoroughly to ensure the data retrieved for disaggregation is as meaningful and reliable as is practical. Evidence of this is shown in that our regular rapid needs assessment, on average 40% of respondents had at least one disability, which this jumped up to 67% in our COVID-19 rapid needs assessments. Next slide. Thank you. When not to disaggregate. We need to be careful not to stretch the disaggregation of data beyond its sensible limits. While I'm sure many of you are aware of these limitations, in practice I've seen disaggregation occur, for example, with tiny sample sizes, thus impacting the significance of this data. Therefore, the end user needs to be provided with the guidance that disaggregated data by sex, age, disability, and by a combination of these characteristics may not be possible in all situations and should not be enforced methodologically unsound. This therefore requires within agencies someone with data analysis skills to lead this process and provide guidance. Other approaches for data collection could be adopted where small populations are expected through key informant interviews or focus group discussions and case studies. In addition, I hope discussions like the one we're having today can continue to build momentum so that larger actors who are able to conduct larger surveys can collect and make accessible disaggregated data. I know progress has been made, but more could be done. I also think it'd be great for more training to be provided on how to access these large data sets. Fundamentally, we do not want to see the kind of proliferation of assessments, which we're currently kind of seeing, rather increasingly tap into pre-existing information sources. Next slide. Thirdly, ensuring teams can effectively interpret and make decisions based on this disaggregated data. There are several elements to this. Firstly, data needs to be displayed in a user-friendly way. At HelpAge, we have recently begun displaying data through interactive dashboards on Power BI, which has enabled us to quickly generate accessible visualizations. This is especially key when ensuring data is inclusive, as otherwise these large amounts of disaggregated data can make it difficult for those analyzing the data to effectively interpret it. Secondly, sufficient time needs to be allocated for the analysis. It is important to explore these trends and the implications thoroughly, linking them throughout to a local contextual understanding. This is ensured disaggregated data does not sit there, but is used. Thirdly, it's important that those whom the data is the most relevant to are brought into this process. For example, we would bring local programmatic staff who we were trying to inform into it, and so they would have greater ownership and understanding what the data means for their programming. Next slide. Fourthly, personally, I think inclusive data should be shared with communities who provide the data. This may be straying slightly off track, but data is inclusive. We need to share this data with the communities who provide the data. They need to be empowered to consider the data, bring their own experience and local knowledge into frame, and help generate relevant local programmatic interventions where possible. In HelpAge, we are in the process of improving these feedback mechanisms, although we've got a long way to go. In Cambodia, for example, the results were brought back and discussed with community leaders who use the data then to create specific programmatic requests. I'll now open up the floor to any questions, very brief presentation. And you also, if you want to reach out to me after the webinar, I'll make sure Sightsavers share my carry on the discussion. Finally, just to mention the last few things is the HelpAge advocacy team are working on currently creating a technical assessment on intersectional disaggregation of data from census and household surveys. And we're also supporting the Titchfield group on aging to produce guidance and tools on better age segregation. Again, if you're interested in any of those things, please reach out and we can continue the discussion. Thanks, I look forward to your questions.
Thanks very much, Alex. Really fascinating presentation and great work being done. I've realised I should probably have introduced myself at the beginning because not everybody knows me. So I'm Dom Haslam, Director of Policy and Programme Strategy at Sightsavers. Alex, I particularly welcomed your point around when not to disaggregate. I really think that that's one of the most important questions facing us now that we've shown that this can be done in almost every context. The challenge is to ensure we do it where we know it's useful and will be used and where it's cost effective, particularly within those stretched statistical systems that we're all working in. So we do have a question from the audience for you. Do you think that the shortening of questions was helpful for the respondents to understand correctly and to provide a reasonable answer?
I think retrospectively, I think the shortening was we kind of did, obviously we created the questionnaire pretty soon after the outbreak of COVID-19, and if we were in a bit of a rush. And there is something to be said about specifically when you're doing phone interviews to be cognizant of, especially cognizant of time. ODI recommends 30 minutes maximum. So we were kind of in this kind of situation. We were like, how do we shorten? How do we shorten? And that's where we came up with that thing. But it has had impacts. So I know the Washington group hasn't tested, or at least as my understanding, the Washington group hasn't tested the questions over the phone. So that'd be something interesting to explore, them to do that and see how that goes, and potentially come back with an even shorter version for situations like this when you're having to do it over the phone.
Yeah, that's really helpful. Thanks. Another, so where you shortened the Washington group short set in your COVID RNA, how much time did this actually save you? This is clearly coming from somebody used to using them. From experience, the short set can usually be done in 2 to 3 minutes. So did it save you much time when you used the shortened version, and would you do that again?
Well, again, whether we do that again, I think will probably be our discussion. It seems unlikely. It does save time because it's what you have to do, obviously, when you're reading out you have to read out all the options when you answer each question rather than yes and no. So it makes marginal gains in time. But yes, not significant. So.
Okay, thank you. And another for you. So when you collect this data, you've talked a fair bit about the quantitative side. Do you also include qualitative mixed methods, or is it mainly quantitative data?
We tend to do. I mean, it's primarily quantitative, but we do have some qualitative elements for example, yes, certain questions have that in. And of course, that creates kind of challenges in terms of how do we put it together. But I think a big one is the need for qualitative, and maybe the need to do a companion. If you're doing assessment, for example, an assessment is a companion qualitative study, where you go back to the communities with your findings and then and have that discussion with them about what this means, what are some of the implications, rather than just taking the findings and the initial data you receive and then using that to write your report. You need that to go back and forth. Otherwise, the quality of the information together is going to be less strong.
Yeah, great. We've got a couple more coming in. So training of enumerators obviously is essential, and I know we all find that with the Washington group as well as with other collections. So how did you manage that without being in the field, as they put it?
Well, I mean, we quite, our approach, and I think this I think be a question probably better done for somebody in country, because I think I'm from a London perspective, but we often, we're very collaborative in the way we do the training. So we train sort of trainer of trainers who then go out to the enumerators and have those discussions. So to be honest with the specifics of the challenges, I think I'll leave that to a presenter who's in context to give you a bit more information.
Yeah, that's totally fair enough. With reference to learning around community kind of uptake and understanding, so what are possible ways to share that data with the communities, given that many don't have access to the reports or in some cases even to broader media?
Yeah, I mean, again, this is something that we're in the process of sort of thinking through. I think, one of the obvious ones is because we operate through kind of lots of kind of local actors who have quite a strong relationship already with that we're working with. So they provide a very easy vehicle in terms of disseminating the findings, and there'll be different methodologies used for that. Sometimes it's bringing together community leaders and then asking that they're shared. Sometimes it's creating flyers, but fundamentally, I think is a really important aspect, which I think is often not done because of the power dynamics that sometimes exist. But yeah.
Yeah, that's great. Thanks, Alex. So one last one before we move on to the next presentation. So could you offer more details on the kind of intersectional aspect of the disaggregation of data, which you mentioned in the presentation?
So is that reference to the multiple characteristics?
Yeah.
So, yeah. So yeah, I mean, in terms of that, I think this a little bit goes back in terms of, when you're doing these kind of multiple analysis, so obviously there's there's elements of how you effectively analyze the data that comes in, which I think, there are certain methodologies you can use to help you with that analysis. But one of the big challenges people face is if you've got so much data, you get swamped by it. And we found that we used to do things through Excel and kind of a bit more lo-fi, but increasingly we're moving towards these kind of visualizations, which make a difference in picking up those intersectionalities and those specific differences. But then having that discussion, giving time to have that discussion, and then subsequently, talking to people with local understanding to unpick, why, where the intersectionalities occur, and bringing everybody around the table, of course, is very important. So we're not just siloed off into sectors. So you look at food and you one look at shelter, but actually we're getting them around a table and we're having that discussion as a group.
Yeah, that's fantastic. Thank you, Alex. Thanks again for the presentation. Thank you for covering off on questions. And I always particularly like panelists who say, I don't know the answer, you need to talk to somebody else. That's always great from my perspective. So thank you, Alex. I hope you're able to stick around with us till the end in case we have some time to pick up some more, because your presentation stimulated an awful lot more questions than we've had time to manage so far. So that's great. Okay, so next up we have the presentation from Claudia Wells of Development Initiatives. Claudia, please, the floor is yours.
Thank you so much, Dom. Great presentation, Alex. Hard shoes to follow there, I think, but hopefully I can build on some of your points in particular about those inclusive processes that are really vital if we're going to produce inclusive data. So thanks very much for everyone for joining, in particular to Sightsavers, UN Women and Help Age for the opportunity to present alongside you today. I'm the Director of Data Use at Development Initiatives, and I lead our work on measuring progress, counting people in inclusive data, and supporting partners to use data for impact. I've got a particular passion for data and the transformative power of data. And I think as a data community, we really do need to challenge ourselves. We've got so much more to learn about how to produce inclusive data and inclusive analysis. And that's why we at DI are really proud to have been one of the founding champions of the Inclusive Data Charter, and why this session is so important. So I'm going to be talking today about some work that we've been doing to support disability inclusive data as part of the Inclusive Futures Consortium, led by Sightsavers and funded by UK Aid. So if I can flick to the next slide, please. So a quick reflection on why inclusive data is so important. Reliable information and data on people provides an important evidence base for inclusive policies, programs and services. But this isn't really just about how data can shine a light on what needs to be done. It's about how data can truly empower rights holders, give voice and provide a tool for accountability to those whose lives we aim to improve. And that's what makes the commitment to the Inclusive Data Charter so important. It's often said that we measure what matters, but in our experience at DI, and I'm sure many of you have had a similar experience, is that time and time again, it's those populations who are most likely to be left behind in society that are missing from data. And inclusive data is about putting that right, filling the gaps that facilitate discrimination and bias in decision making, and making sure that everyone counts and is counted. So before I look at our specific example, where we've done some work to improve the disability data ecosystem in Uganda, I just wanted to flag to you all some figures that we did when we produced some data looking at aid flows into projects that support disability. And I think it's a good example that shows actually inclusive data doesn't always need to be applied to data on people, but it's just as important to disaggregate data on financial flows as well. So if I can just flick to the next slide, please. So at the beginning of last year at DI, we began to look at how much we could disaggregate the OECD DAC data to identify projects that were supporting disability inclusion. This work builds on work that had already been done to introduce a disability marker onto aid projects and looks in more detail at the project descriptions to see whether we can identify projects that specifically support inclusion. And it also enabled us to look at how that aid was dispersed to projects on the ground. Now, I'm not going to go into the detailed methods, but I'm happy to be contacted afterwards or just to discuss those with you afterwards and to share with you the methodology. But what we found, I think, for me, was quite troubling. First of all, when we looked at all disability relevant aid, only 25% of that was identified as disability inclusive. So specifically supporting people towards full and equal participation in society. When we looked at that 25% and further broke it down to look at how that money was being dispersed, we found that only 3% of that aid was channeled via organisations that specifically represent persons with disability, either at national or international levels. And I think this data provides crucial evidence to challenge donors on their processes and to ensure that programming is truly compliant with the Convention on the Rights of Persons with Disabilities. And I think that just gives really important context as to why inclusive data is so vital. So if I move on now to the next slide and talk to you a little bit about our experience in Uganda, about mapping the disability data landscape. Generating inclusive data needs to be a nationally owned process. And so the first step was to engage with the disability movement on the ground to understand more about what they thought about the disability data in Uganda, to learn more about the challenges around the ecosystem. We looked at governance and legal frameworks that were in place to collect disability relevant data. We also considered the sources and the use of that data and identified some key challenges. The first was that it was really unclear what data on persons with disabilities was available and how that data was being used. There was a lot of uncertainty and a lot of misinformation, in fact. But when we looked at the detail, it was clear that more data is needed. This wasn't just a case of opening up data that was already there. Actually, on employment and employment skills of persons with disabilities was a real data gap. So what do we do to address some of these challenges? And if we look at the next slide, you can see some of the recommendations that came out of our paper on when we mapped the disability data landscape. So really in partnership with the disability movement in Uganda, we looked at recommending a representative Ugandan disability data working group to address some of these challenges around coherence, quality, governance, quantity, and accessibility of the data. And in particular, to ensure that it met the needs of the stakeholders from the disability movement. That group, we called for that group to be funded potentially from existing donors so that they could reallocate some of their budgets. And we sought to develop new relationships with other donors. And we've developed a concept note for putting that group together so that they can start to really develop a strategy to improve the data landscape on the ground. So if I move to the next slide, you can see a little bit about how we're proposing to make up that group. So one of our key learnings from working on data landscapes and data ecosystems is that if we want to make data sets join up or interoperable to ensure that they're more inclusive, coherent, and we're making the best use of data available, the hardest thing that you've got to do is to get the people to join up first. And that often takes longer than working with the data sets, which is why this group is absolutely vital. We need to bring the stakeholders together, like Alex was saying, and then we can address the challenges of bringing the data together and filling those data gaps. The concept note for this group is currently in development, but vitally it brings together that multi-stakeholder representatives representing all sectors to drive this strategy forward. Organisations representing persons with disabilities are at the heart of this group, and they join together with the National Stats Office to facilitate the bringing together of these diverse stakeholders. In addition to the National Stats Office, we're including all of the relevant line ministries that have legal and governance requirements to collect and facilitate programs and collect data on people and persons with disabilities. But also we're including key donors for whom disability progress is a priority, and the private sector and academia to look at how the strategy can really meet the needs of all of these stakeholders. It's not an easy task, and we've got some key learnings from all of the work that we've done over the past 2 years. And these are my top 3 takeaways on the next slide. So the first is all about partnership, working with organisations that represent these communities from the very beginning. And I can hold my hands up here and say we didn't get this right straight away at DI. When we first looked at tracking aid flows that were relevant for projects that support people with disabilities, we didn't engage with the community straight away, which meant that we didn't take into account the importance of inclusion within that. And it was only by subsequently working directly with these organisations on an improved methodology that we were able to produce that data that could be disaggregated by inclusion and for different states and different kinds of disabilities, providing vital new evidence. So partnerships is just really, really vital. And it's not just about participation or consultation. It's about really facilitating and allowing the time, developing the processes that support leaderships from that community level. The second is preparation. Ensuring inclusive processes takes time. This is not something that you can rush. You need to plan and you need to budget for this as well. And it's very easy to make mistakes if you're trying to do things fast and forget simple things like making sure that you've got closed captioning on your webinars. So huge amounts of learning there about really planning and consulting on those plans with organisations that represent these communities from the beginning. And finally, it's all about process as well and making sure that knowledge is institutionalised within your organisation. We've done things like develop internal checklists that allow us to ensure that we are now meeting the inclusivity requirements that are so vital to us. We've got lots more learning. Those are just 3 of my top tips, and I'm happy to answer questions on any more, but I'll be quiet now and take questions from the floor. Thank you very much.
That's great. Thanks, Claudia, for a great presentation. And from my view, anyway, particularly good to hear the work you've done around bringing stakeholders together. So I might just jump in with a question first, invoking moderator's privilege, if that's okay. So how easy was it to get this as a priority on the agenda of the government stakeholders that were part of the group, given we know how stretched national statistical systems are and how much data they're increasingly being expected to gather and analyse?
I think that's partly the reason why it is important to bring people together, because quite often it's not just about producing more data, it's about understanding what's available, the sources and the mechanisms for data collection, and making sure that you're being really efficient across the system about that and not duplicating things. We found that a lot from our landscaping work, is that often data collection is duplicated. So I think coming from an angle of efficiency helps. I think there's an awful lot that the disability movement can learn from the gender movement in raising the profile and the importance and the need for this data as well. And it was really, really vital to bring those ministries in at the beginning of the process, just like we did with the organisations, to understand the challenges that they're facing as well. This isn't us coming in saying, you've got to do this, there is a gold standard. This is us saying, there is a pathway there to improvement and we can facilitate that. But it is a process.
Yeah, that's great. Thanks, Claudia. Okay, the questions are coming in thick and fast now, so I'm going to try and get through a couple of them with you. So could you clarify which specific indicators were used in the Uganda example when collecting inclusive data, specifically around disability inclusive data? What indicators did you use?
So we did a landscaping across the entire data ecosystem. So rather than starting from the point of the statistical analysis, we do a landscaping methodology that looks at the data collection processes, so the sources of those data. So we kind of mapped out which ministries had a remit to collect that data, and then looked at the individual sources to see what was being collected, rather than specifying a set of indicators from the beginning. If that makes sense.
Yeah, absolutely. So working from what's there, which is great. You referred to regulation and governance. Have you found challenges in different data protection regulation in other countries?
So in terms of the governance, what we found was that there is a lot of commitment there, and actually sometimes a bit of a misunderstanding in terms of the governance and the data sharing rules within government and across line ministries, actually. And so that, I think that is a real key area that we need to look at, in particular, looking at rights and privacy, and what Alex was saying before about when you don't disaggregate, especially when you don't make things publicly accessible. But to understand that there are ways to work with these data sets that does protect those fundamental rights.
And then just one final one, because we'll need to move on after that, but one that I can completely relate to. So planning for a strategy on disability inclusive data is a huge piece of work. Would it be global or country specific that you're looking at?
So that is very much country specific. That is a fundamental principle for how we're working. These processes need to be nationally and locally owned to be sustainable. And every country is at a different stage in the process. This is not about saying you've all got to do this to a certain gold standard. It's about thinking what that pathway to improvement might be and making the best use of what you've got already there. So certainly at the moment, we're focused very much in that specific national space.
That's great. Claudia, thanks very much. I hope you can hang around for questions at the end, because I'm desperately trying to get us to reserve that 15 minutes so we can come back to you with some of the others. Thanks everybody for all the questions that are coming in, and we will try and get to ones that I haven't had the chance to pose to Claudia at the end. So thanks again, Claudia. Manaza, next we have Manaza Gilani from Sightsavers. Manaza, I hope you're ready to go, and the floor is yours.
Thanks, Dom. Hello, everyone, and welcome to this very interesting session on inclusive data. So far, two very remarkable examples of inclusive data have been shared by our esteemed panelists today. What I would be sharing is the learnings from our inclusive eye health program that is being implemented in Bangladesh and Pakistan. The learnings are specific to Pakistan, but not very different from Bangladesh. And these learnings are from a 3.5-year project, which is funded by the UK Aid Matching Grant since 2018. Next slide, please. So my presentation will cover the theory of change of the program, its objective and the key components, the data collection pathways, some key lessons learned about the disability data disaggregation collection, and some recommendations for the future programming and planning. Before I start, let me share why Sightsavers think that disability data disaggregation is important in eye health programming. We all know that there is a lack of accurate and comparable data, specifically in health sector on disability globally. So this is a critical development issue which prevents addressing the needs of people with disabilities. And we as an organization are committed to disaggregate data by disability because it aligns with our empowerment and inclusion framework. And in addition to this, we are also committed to adhering to the SDGs and leaving no one behind agenda. So it will inform our programs to be more inclusive of people with disabilities and will also allow us to address any accessibility and awareness or equity issues that we identify. Next slide, please. So in Pakistan, which is the 6th most populous country of the world, people living with disabilities are facing the challenges which are very profound for them. Because disability intensifies poverty for the whole family of the person with disabilities due to so many increased barriers and obstacles. And we believe that this can be mitigated through appropriately targeted health services and inclusive approaches to include people with disabilities. And the theory of change of this project is guided by the principles of affordable universal health coverage and a health system strengthening approach, which is based on the WHO's 6 building blocks. The overall aim is basically to achieve the long-term sustainability of the inclusive eye health approaches, comprehensive accessibility of the infrastructure, the knowledge and the positive attitude of the eye health staff toward gender mainstreaming and disability inclusion, and the use of the disaggregated data to inform our strategy. In addition to that, at policy level, our goal is to ensure that policy makers at local and national levels are committed to implement inclusive health policies. And for this, we took a health policy context analysis in Pakistan to feed into our advocacy plans. This analysis, together with the consultation with key stakeholders, has helped us to understand the potential gaps, opportunities for the possible policy changes that are required at the moment. And our bespoke advocacy plan is actually guiding the key advocacy activities, and the success is being measured through our advocacy monitoring tools. Next slide, please. So the key components of the project are the disability data disaggregation using the Washington Group short set of questions, and which is actually helping us to disaggregate the data by age, sex, and disability. The capacity of the frontline health workers is being strengthened by training the hospital staff on disability inclusion and mainstreaming, and its disaggregation tools and techniques, which is an investment that will actually help and will continue post-project funding. In addition to that, the dedicated outreach screening camps for the marginalized communities are also being conducted and are integral component of the project. For instance, people with intellectual impairment, transgender people, and some ethnic minorities their needs have been addressed through these camps. And in this regard, the organizations of persons with disabilities and self-help groups have played a great role in identification and bringing the most marginalized people to these camps. The behavior change communication campaign is targeting both the demand and supply side of the eye care in a way that the needs and barriers faced by most marginalized communities are well understood. Another core element is a clear evidence-based advocacy plan using the inclusive data and its analysis for the policymakers. And in this context, the most recent development is our partnership with the relevant ministries for integration of the disability indicators in SDGs monitoring tools at national and provincial level. Next slide, please. So the data collection. Disability data disaggregation has been collected from a sample of patients in 2018, 19, and 2020. And due to the high number of patients accessing IL services in both countries, it was agreed to use a sampling approach at health facilities and outreach camps. A sample size was determined based on the average number of the patients who are accessing the services at IL facilities and outreach camps in a given month. And during the data collection periods, patients were randomly selected each day at the point of registration for those coming for eye screening at the health facilities and outreach camps. Data collection continued until the desired sample size was met. And the partners who have been using these tools, they really appreciate the potential for the information to reflect on any adjustments that may be needed in service delivery and accessibility, such as infrastructure, timing and location of the services, the camps, the communication methods being used to inform the beneficiaries about the services, the outreach and patient transport options. And the good thing is that there is a strong appetite among partners to continue with the pilot survey approach and to reflect on their internal capacity to absorb this disability data disaggregation routinely. So what we have learned about piloting this approach. Next slide, please. Well, we have learned that disability data disaggregation is a strong catalyst for attitudinal shift. Partners have agreed for a need to continue to build the internal business cases for the DDD integration, drawing on the values of insights that have been gained and their potential for services improvement. They are also keen to work on communicating internally and externally about the DDD experience, particularly to avoid creating a perception, which is very common, that data on disability will necessarily lead to demands for increased funding, which is obviously not very correct. It is also learned that disability requires contextual and cultural consideration, as the type of stigma and perceptions shapes the attitudes and behaviors very strongly. So the cognitive testing of the questionnaire is really, really important. We also learned that well-informed patients about why we are asking the questions in the questionnaire are the best respondents. Next slide, please. So the use of the Washington Group short set of questions may show a sudden unexpected increase in the number of patients or beneficiaries with disabilities in the database, especially at eye health facilities. And maybe a reason is that a big chunk of this number are 60+ people in age. So this is one of the learning. We need to integrate the disability data in the job descriptions and roles of the existing hospitals and should train them on regular basis. Asking the Washington Group questions may raise unnecessary expectations at the beneficiaries level and sometimes at the staff level as well. So the purpose of the questionnaire should be explained very well before administering it. In addition to that, the advocacy and influencing policy shift in the data collection and at national level is very much needed through creating strong evidence, which is now being available in the form of data which we have gathered over the period of time. Next slide, please. So a few recommendations. The sensitizations on the disability mainstreaming and use of Washington Group questions should be completely aligned with the local and cultural context. The program has actually given us the opportunity to continue to learn about the challenges and benefits of using these questions. and the survey design and approaches in programmatic context, and to begin to interpret what the data actually means. Health partners are committed to continue to learn about the limits to the data, as well as exploring the potential for the data to support improvements in their strategies to be more inclusive and accessible. We think that more research is needed to know how people with or without disabilities perceive the quality of services they receive. And for that, after the second year of the project, facilities are now systematically considering the patient satisfaction findings in the context of clinical outcome findings or vice versa. So this may be a potential future research question of interest for us. Next slide, please. So as a way forward, we think that we need to explore the use of the Washington Group questionnaire alongside some other tools, and we are exploring these options. The disability data disaggregation experience of patient experience or satisfaction measures is necessary to understand more about the quality of the services being received. And an important learning for the future is that we need to ensure the systematic inclusion of the disaggregated data in the whole project cycle management, and also for the research analysis. And last but not least, a strong advocacy plan with research-based evidence is needed to influence the government's policy and planning levels for accurate, comprehensive, and better data across the development sector. So thank you. Please, if you have any question, please do raise.
Sorry, struggling to move between various documents, Manazza. Thank you so much for your for the presentation. That was great. I'm not going to invoke moderator privilege because we have a load of questions coming in, and to be honest, there's probably other opportunities for me to have a discussion about the program with you anyway. But yeah, I particularly appreciated the point you made around the advocacy planning process to go alongside the data planning process. And that does lead on to a question that was asked earlier. So could you maybe share some insight on how disability inclusive or other parts of inclusive data could be fed into sectoral policy dialogues and general human development discussions and discourse at the national level, I guess, particularly with government?
The way we are doing it, that we are trying to integrate the whole process within the whole SDGs monitoring process in the country. And for that, we are collaborating with the Ministry of Planning and Development, who are the key custodians for that. So what we are trying to do, we did a kind of a mapping study to explore the essential data sources of disability that can feed into the SDGs monitoring process. And in that context, the learnings and experience from the Inclusive Eye Health Project has helped us a lot, because we were already having this information available. Based on those learnings, now we are entering into the other education and social welfare and social protection sector as well. And because of the learnings and experience being available with us, the government is listening to us, and the Ministry of Planning is actually very much inclined towards how we can mainstream disability in the whole SDGs, not only in the reporting process, but also in the monitoring process. And this can be actually integrated into their monitoring dashboards and at various levels at national and provincial level. So this is the way we are taking it forward.
It's great, thank you, Manazza. Just in the interest of time, I'm going to take one more question before we move on to hear from UN Women. So what would you say to organisations who think that the use of the Washington Group questions is too expensive and that they're too complex to be used realistically?
I don't think it's complex or expensive, but it should be administered very carefully, especially when you are administering it in an environment like Pakistan, Bangladesh, or any low and middle income countries, where the local context and the cultural norms are very, very strong and can influence the whole process. So before administering it, it's very, very essential that we pre-test it very carefully and especially the cognitive testing in a place where more than like 40 languages are being spoken in a country. So you have to test it cognitively very carefully in each language, which has a different dialect after every 10 kilometers. And because the interpretation and the meaning of the question can be totally misunderstood if not being administered carefully. So what I would suggest that more investment is needed in the training and the right interpretation and administration of the questionnaire, rather than into the physical investment, like making it part of the questionnaire or HMIS or something like that. But before that, the first step should be to pre-test it very carefully and document your learnings, and then compare with other geographical locations and maybe with other countries if possible. So this could be a very good comparative analysis to go ahead if we administer this carefully.
That's great. Thank you. Thank you again, Manasa. That's fantastic presentation, and thank you for answering the questions. Again, I hope you can stay with us, because I'm thinking we might just about make a few minutes of time at the end for some general questions, and there are plenty that came through during your presentation that we didn't get around to asking. So thank you again.
Thank you.
Thank you. Finally, but not leastly, of course, we have Papa Alisou Seck of UN Women. Papa, we're very much looking forward to hearing from you, and over to you. The floor is yours.
Great. Thank you very much, Dominic, and really a real pleasure to join you all. What I will talk about is really, I think, the work that we've been doing at UN Women, particularly in the context of our Global Women Count program, and really how we've tried to collect inclusive data as part of the program in order to address some of the challenges we know about, when it comes to gender statistics. So capturing intersecting inequalities, as has been talked about here, really requires data that are disaggregated by sex, age, and lots of other characteristics: class, race, location, disability, education, migration, etc. But also, I think one of the key points that I've also been hearing is something that we've seen in our own work, which is the need to really deliberate carefully before choosing topics and asking questions on how different groups of people may be differently affected. And even during better times, prior to COVID-19, only 31% of the gender-specific SDGs indicators could be reliably monitored at the global level. And when we add characteristics such as age, class, race, disability, and so on, even fewer data are available, not even talking about data over time. So it is with these challenges in mind that, and the need for really better data to monitor the SDGs and the pledge to leave no one behind, that we've been using these as basically the guiding principles for the implementation of the Global Women Count data program to improve the planning, production, and use of gender statistics globally. And one thing that we wanted to pay particular attention is how to address gender and intersecting inequalities and ensure that this is the default rather than the default approach rather than an afterthought, as is often the case. But also, I think one key element that really, I think, again, is something that we've been learning about is it's not just about producing the data, it's also about ensuring how it's used. And that's where I think all of the challenges and the complexities of working in this area really come in. So a case in point has been a project that we've been implementing to develop a global toolkit to better utilize existing household surveys to generate disaggregated gender statistics. And we've been doing this in collaboration with the Intersecretarial Working Group on Household Surveys, which I co-chair. And in fact, and this initiative is actually led by one of my colleagues who's in this call. Her name is Jessamine Encarnacion. And if there are any questions, I would definitely want her to come in because she's really been leading this work in collaboration with the ISWGHS. And for those of you who do not know the Intersecretarial Working Group on Household Surveys, this is really, I think, an important global initiative set up under the auspices of the UN Statistical Commission that includes countries and UN agencies. And the aim of the group is really, I think, improving household surveys for SDG monitoring, including really focusing on disaggregation as well. So I would definitely advise you all to look at it, and I'll share the link to the ISWGHS website shortly. The global toolkit, just to come back to it, measures, showcases country-led initiatives to produce gender statistics with multiple disaggregation. And so the toolkit covers 5 major stages undertaken by countries. Really, I think, to show also, I think, the complexity of the process if we are really aiming for a process that goes from identification of issues to data production, to the use of the data, and so on. And the first stage is about ensuring the leadership and commitment of the national statistical system to produce more and better gender statistics, which is fundamental. And here I'm talking about the national statistical system, not just the National Statistical Office. And I think that's really important. And here, in the toolkit, we give the case of the example of Cameroon. For stage 2, the identification of national priority gender equality indicators. And these are really identifying national priority indicators that speak to policy objectives in the country that are identified and agreed by multiple stakeholders. And there, in the toolkit, we showcase the example of Vietnam. For stage 3, which is about developing methodologies and producing statistics on select priority gender indicators, we are showcasing Pakistan and how the use of GIS information basically has allowed us to do that. For stage 4, the assessment and publication of results, we use the case of Mongolia. And finally, for the last stage, which is on effective dissemination, advocacy, and use of gender statistics, we showcase the release of the first edition of Women and Men Gender Gaps in Colombia, where the participation of the vice president indicated a clear demonstration of the strong and high-level support of the national government in this initiative. And of course, we can provide more info. I won't dwell too much on each of these steps and know what is involved and the examples that we've provided, but again, we can share with you the summary, executive summary that was submitted to the UN Statistical Commission, and there you can see more details about each of the different steps. But rather, for what remains, I'll just talk a little bit about some of the lessons that we've learned at each of these stages. First and key is that the initiative requires strong commitment of institutions and actors in the national statistical system that are working on gender equality and women's empowerment, including the leadership and commitment of the National Statistical Office, but also the National Women's Machinery and all stakeholders involved. And to insist, this is a process that cannot be driven by donor agencies, UN agencies, or etc. Intersectionality is first and foremost local. Policies to address it are also local, so the data that is needed to inform it needs to be local as well, locally produced, locally deliberated as well. And related to that, gender data production, the gender data production process shouldn't be user-oriented rather than product-oriented. Being user-oriented really means that it is crucial for the data not to be extracted. If it is, it won't be useful. So any such initiatives should be undertaken within the framework of nothing about us without us. So qualitative assessment should involve the specific populations of interest themselves, as well as other prospective users and those knowledgeable in the type of disaggregation being studied. The basis for the selection of gender indicators to be disaggregated should be clearly guided by priority and policy relevant indicators and that are identified and owned by both producers and users. And again, so and I'll get to that in the end, and which is, I think, one of the key lessons that we've also been learning as part of the Women's Count program as a whole. Another point is that we can get a lot from, and we've heard that here, we can get a lot from existing household surveys. They can be better tracked to produce a lot of disaggregated data. And but also, I think one thing that we can learn from these types of processes is understanding not only what can you get from existing surveys, but also how you can change existing surveys to get to the issues that need to be measured. So that for countries that have, for instance, household survey programs, those changes can be integrated progressively into surveys, so that they can be helpful to measure what essentially what users and what the development policies in countries really need. Technically speaking, the estimates of smaller domains or subdomains, so which are, be they geographic or subpopulation groups, may not necessarily have been considered when the household surveys were earlier designed. And this process of, identifying priorities and so on can tell you exactly what to do the next time around. But also, I think one of the issues that we try to solve as part of at least this toolkit is really looking at, determining whether disaggregated gender statistics are sufficiently precise and reliable as measured by the standard error and the coefficient of variation in estimating the true value of the indicator. There are currently no internationally agreed standards or recommendations regarding sufficient levels of precision and reliability. But I think this is an area of work that really, I think the international community could provide quite a lot more guidance in terms of, what levels of reliability we should use. But also, something that I think we should systematically do more often, which is to start producing the coefficients of variation and publishing them as well, so that people can see, don't just see the mean of the means, rather, but can see, I think, the full spectrum of statistics that should be published. So just to say, the Candidate Visible Toolkit is a living document and is not intended to be a final word on how to better utilize existing surveys to produce disaggregated gender statistics. We are working with the Intersecretarial Working Group to consider this as a very dynamic document that should be periodically updated as other countries use and adapt to the toolkit for their own needs. And the contribution of national statistical systems and their country experiences, challenges, and learnings are really, I think, a key to the success of this toolkit. And this is something that we will continue to work on for the next years. But it's not just also, again, as part of the NSS, we also consider, civil society groups, researchers, and so on. Really, I think looking at a diverse set of stakeholders that can really contribute to this. Thank you very much.
Thank you so much, Papa, and particular thanks to you for joining us hot out of a senior level meeting, which I gather you were called into just before the session started. So I very much appreciate that. We know you're a hugely busy man, so very much appreciated. It was really good to hear in some detail about another example of using existing data sets, in this case household surveys and others, to improve our understanding of the status of inclusion and equity, and of course that has to be a key part of the solution. I'm going to ask you what might be a very difficult question to answer, so apologies for that, but just from your gut feeling, how much of the current gap in our understanding around equity do you think can be filled by adjusting or using these existing data sets rather than setting up new surveys and developing new tools?
So actually, I would say a lot. So there's clearly, I think, a lot that we don't know yet. but there's a lot of information that is already contained in existing data sets, household surveys, or administrative sources in particular, and so on, that can give us a lot of information. I think where we probably do not have, haven't had, I think, a lot of engagement is basically in determining what those priorities should be, right? So where we found, I think, what we found in our work is that basically once you go down to the national level, coordination mechanisms for gender statistics, for instance, are hardly existent in countries. But in order to improve the production and use of gender data and statistics, you really need those institutional elements to be present, where it's not just the National Statistical Office that is tasked with producing something. It is also in the planning, the National Statistics Development Strategy, proper coordination that includes different stakeholders and so on. And what we've seen in Kenya, for instance, is that, and that's just one example, where once you improve coordination, a lot of benefits come out of it. So both in terms of contributions from civil society organizations that bring their own data to the table, but also a better understanding from national statistical officers of why they need to do this work. So it's not just left up to them to determine what is relevant to produce and what relevant disaggregations to produce, because disaggregation per se can be a bottomless pit, if you will, where you only stop by the statistical precision that we have. But once you have, I think, those consultations with civil society and with other stakeholders, governments, and etc., you know better where to focus your efforts, and that I think can really help you to already extract a lot from existing data.
Thank you, Papa. And just in the interest of time, one final question for you. So so somebody's very grateful for the initiative. Thank you for the initiative. You're disaggregating gender, and you've talked about gender a lot, obviously coming from UN Women, completely appropriate. So do you have any plans to integrate any other aspects of marginalization, for example, disability, income status, and so on in the work that you're focusing on?
Yeah, no, and exactly, and that's what we mean by intersecting inequalities. So it's not just looking at, when we are looking at gender inequality, we're also talking about gender and age, right? So the intersections of gender and age, gender and disability. We're looking at disability. So I think it's basically those intersections of gender and other characteristics that we are talking about. So, for instance, the point about disability is really important here when we're talking about gender, whether we are talking about violence against women or we are talking about access to the labor market. Gender is a critical, gender and disability essentially intersect in very, very specific ways. So does gender and age, and disability, and so on. But really, I think it's we're not just talking about sex disaggregation, but simultaneous disaggregation by various factors. And I can perhaps refer you to also a report that we produced in 2018 on gender and SDGs. I'll go and share in the chat. And chapter 4 of that report really, gives you I think a fuller sense of what we mean by these multiple levels of disaggregation using existing data.
Very much look forward to seeing that. Thank you, Papa. Thank you, and maybe we can share that when we share the recording round with the participants. I know there's been a few links to resources in the chat as well, so perhaps we can add those. So I'd like to thank all of our panelists. We have a few minutes left, so please, if all the panelists can maybe join us on screen now. I think we've probably got about enough time for one question for each of you. So let's see how we go. So I'm going to start in the same order that we did the talking in, so everybody has had an equal chance to rest before these come at you. So Alex, I'll come to you first. So in your experience with disaggregated data, what proportion of people the question focuses particularly on people with disability, but in general, what proportion are found to be excluded if disaggregated data collection and reporting isn't used? So it's quite a general question. What problem is this solving? Do you think? What level of the population will miss out unless we continue to improve in our collection of disaggregated data?
I think that's asking me, is kind of asking more generally the usefulness of disaggregated data. I mean, I think, you know, from our assessments, and specifically, we have obviously an age focus, being Help Age. You know, we do see, you know, there's numerous countless examples of where we're unpicking these kind of outliers, where there are certain kind of groups which maybe, if you were not to disaggregate the data, would not be kind of missed out. And especially when we're sort of building programming, understanding these various dynamics has a massive added value. You know, so for example, understanding you know, well-being, how well-being changes, and mental health might change psychosocial over time. So certain older groups might face this more than maybe those in their 50s, and then targeting our program based on that has been informative from a very kind of practical programmatic level. So that's just one example of many of how that disaggregation has helped inform us.
That's great. Thanks very much, Alex. Claudia, coming to you next. So this actually came up during your presentation, so but we didn't have time at the time. So how did you come up with a standardized methodology working with all of the various stakeholders that made up your disability data working group? What was the kind of process? How difficult was it to come to an agreed approach?
So the disability data working group was a recommendation that came out of our initial analysis. So isn't actually working in practice. That's the big task for this year. So perhaps you can come back to me at the end of the year and ask that question. And we'll certainly be looking at ways that we can support that process and facilitate that process throughout this year, so that that group can take forward some of the recommendations. But yes, I still think there's a lot of work to be done there on bringing them together to understand their common needs and goals, so that they can look towards that standardized methodology. So I'm afraid I haven't got an answer for that one, Dom.
That's fine. I'll make sure that we set up an inclusive data learning session 2, the return. And
yeah, the return.
You can attend again.
I'm happy to answer the question. There was one in the chat about the value of health information systems.
Please.
I think that they play a really vital role as part of that foundational data systems to make data more inclusive, because household surveys alone, while they are beautiful from a statistical point of view, don't capture everyone by design, and quite often they're masking those inter-household characteristics. So we need to look at the individual to really bring out some of the issues around inclusivity. And there are ways that you can do that. There's a kind of an individual deprivation model that is being developed that looks at deprivation very much from the individual's perspective rather than the household perspective. But I think joining up these types of data with other foundational data from administrative systems is the vital way forward to make sure that we count everyone.
And I think that connects very much with a lot of what Papa was saying as well. So yeah, that's a great point. Thank you. And thank you for answering, well, nearly answering 2 questions as well. So Manaza, I think this is one probably best suited for you, and I know it's something you've done a fair bit of work on. So in terms of the Washington Group short set, what's been your experience around translation issues into local languages? And I guess in particular, drawing from a second question, dealing with word usages that would be considered derogatory amongst the community in terms of people's self-identity and self-assessment. What's been your experience around those sorts of issues in Pakistan?
Sorry, I was on mute. So yes, this is a very interesting experience, I must say. The translation in local language was very sensitive. Initially, we outsourced this to language expert people who are actually like authorized to translate in the government sector. But when we come up with the translation, it was something which was not very well understood by a layman. So it was having difficult terminologies being used and all that. So then we realized that before finalizing this translation, we have to pre-test this in the original context and the atmosphere where we are going to use it. So we pre-tested that in hospital settings, in outreach camp settings, and also in the local communities where we are implementing our project. And interestingly, in those areas, more than 2 or 3 languages were being spoken, and people were interpreting different words differently. So we then went back again and we translated them in all the possible languages, local languages like Pashto, Urdu, Punjabi, Saraiki, whatever language was being spoken there. And then we again sat with the language experts and made them really, really simple for the beneficiaries, so that whatever we are asking, they can well understand. I can just give you an example that when we asked the question around, do you feel any difficulty focusing on or memorize, or any problem with your memory? People misunderstood that question initially. When you say focusing, they saw that is something related to their eyesight, and they gave the wrong response. And suddenly we saw a sudden surge in number of people identified with visual impairment or having difficulty in sight. But that was not a correct response. So we went back and we checked the data again, analyzed it, and then we identified that this question was misunderstood. So this is something very interesting, but it really needs input from organizations of persons with disabilities, the local self-help groups, the local level stakeholders, and the beneficiaries themselves. So their input and their cooperation and their engagement is very, very critical before finalizing any translation or cognitive testing. Yeah.
That's great. Thanks very much, Manaza. And finally, Papa, to you. So have you been able to use intra-household surveys and techniques for identifying how members of households might be impacted by issues differently? So the specific example given here is in terms of asset ownership and access to assets, and how in the case of death or divorce, women can often be disadvantaged. So are there ways to use these existing sets to look at that intra-household inequality?
Yeah, thanks. And actually, I was responding to that question on the chat. So one of the projects that we did a few years ago actually was with the UN Statistics Division. It's called Evidence and Data for Gender Equality. And precisely the issue that we were looking at was about access to assets, but looking at it from a, rather than, whether the household owns any assets, which is usually what is done, looking at it from the perspective of individuals within the household. And, again, there were lots of lessons learned from that work. And, that question is not trivial at all. And it involves quite a lot of complexities in terms of, what do you measure? How do you measure it? Particularly when we are talking about land. And, there were lots of lessons that were learned from that project. And I've just sent the link on the chat. Really, I think the report was presented to the UN Statistical Commission and endorsed. And really, I think provides a lot of food for thought on how do you do household surveys that look at individuals rather than households, if you will, and look at inter-household issues. I mean, we do that when it comes to time use and other things, but not in some other areas. We've also done quite a lot of work with UN Habitat looking at slums, or ILO looking at labor force participation of women with children and so on, that my colleague Jessa has shared in the chat. All of those basically looking at the individual rather than the household. So there are, again, lots of lessons and we are taking those lessons integrating them into our programming and data collection.
Thank you so much, Pepper, and of course thank you to all of our panelists. We're drawing towards the end, so we're going to move on now. Thank you so much for all the questions that have come forward. I'm sorry we haven't got to all of them. I'm hoping that we have captured all the questions. So what we'll try and do is share those with all the panelists, because I hope that even though they may not be able to respond to you directly, I hope the questions that have been raised help to inform their work into the future. So I'm sure all of us will find that really useful. Thank you. So first and foremost, obviously, I'd like to really thank all of the panelists for all of your fascinating presentations, all the work that you're doing, and of course for being so ready to share that learning from your work and from your organizations. I'm also going to thank the Maximise Your Time MYT team and the Sightsavers teams for all your work behind the scenes. Thank you. And also to all of you for your active engagement in the chat and so many insightful questions. Thank you. I think this is clearly an issue that we'll be coming back to over and over again. Just a reminder to take part in the Zoom survey at the end for your final piece of participation in the workshop. I would just like to go back to something that Alex shared in his presentation and that's come up a few times, and there was a question around this as well, around when not to disaggregate. So I think what we've seen today is that many organizations, not just including these four, but far beyond these four organizations, and in particular national statistics offices, increasingly are collecting data that's disaggregated on a scale that we've never seen before. Which is fantastic, and there's a huge amount more to be done, of course, but we do also need to have this conversation about when not to disaggregate. How do we get the best, the most useful data to do what inclusive data is all about, which is informing good policy and implementation decisions that improve people's lives. I am so heartened and so excited. Data gets me very excited by the willingness of these agencies to share their learning and their work with us, because in the end, that transparency is going to be critical when it comes to answering that question of when to disaggregate and how to do it best. Inclusive data, for me, is going to be one of the most powerful tools that is ever put in the hands of governments, and more importantly, even the people they are accountable to. So let's all keep learning, keep sharing, and I hope keep improving. And I really look forward to the debate continuing with all of you. And thank you once again for your interest and participation. Please do fill in the Zoom survey. And that's all from us. So have a great rest of your day and goodbye.